And now, back to Louisiana Living.
And welcome back. I'm here with Jennifer Zimmerman, owner of Medicare Healthcare We Care, with this month's The Landscape of Healthcare. Jennifer, thank you so much for joining us.
So glad to be here, Ashley.
Glad to have you. And so we're talking about savings on prescription medicine.
Yes, so healthcare rates have been skyrocketing, and a lot of it is due to the cost of medication. So just wanting to spread the word that people really are going to have to get proactive on checking the manufacturer website for discount cards, maybe downloading GoodRx on their phone to see if maybe there's a cheaper cost on GoodRx as opposed to using your card at the pharmacy, your insurance card, as well as maybe even Mark Cuban's pharmacy. If you get generic drugs, Mark Cuban has this pharmacy that you can order from online. It's just getting to a point where you're going to have to put some skin in the game to keep those costs down as the drugs go up.
And why are the costs of drugs going up?
Just a lot of people on a lot of medicine, for one thing, and some of these drug manufacturers will sunset medicines that have been around for a long time. They're generic, they're inexpensive, but they'll sunset that drug and come out with something kind of new to be able to charge more for it. They're in the business of keeping people healthier, but they're also a business.
Good
so
advice.
They want to make money.
When does open enrollment start?
So open enrollment for Medicare is starting October the 15th, and this year the big kind of the calamity is Vantage Healthcare is exiting the market, so all of the Vantage people are like, what am I going to do? So they will have the option to, during this open enrollment time, they'll either get moved over to a Blue Cross plan, which Vantage will do automatically, or they can look out in the open market for plans that are available to them.
And what are your suggestions and tips for those people who are going to look out in the open market?
Yes, to get on the calendar with someone. There's only October 15th to December 7th. It's not a lot of business days, and you just want to be working with someone that can review your medicines, your doctors, the networks, to make sure that by December 7th, you're in the plan that you need to be in, because there's no going back. You're stuck with whatever you pick by December 7th.
I'm seeing a lot of commercials. Do you recommend that you talk to a human, a person, maybe someone local?
I do. I think there's a segment of society that can go online and compare and make an informed decision based on what they see online, but more often than not, I think they're looking for an advisor that it doesn't cost them anything to work with an advisor to help them find the best plan.
Real quick, Jennifer, how can we get in touch with you with questions?
My phone number is area code 318-450-3203, and you can text, fax, or call that number.
All right, thank you so much, Jennifer. Great to have you. We'll
Yes.
be right back.